Morning, everyone. Welcome to Hot and Smoky, a new normal. I am Catherine Pavoni. I'm the Director of Industry Programs and Services at ActSafe, and will be facilitating our conversation today. I am speaking to you from my home office, which is located on the traditional and unceded territories of the Coast Salish peoples, Musqueam, Squamish, and Tsleil-Waututh First Nations. Before we get started, just a few housekeeping tips to go through for everyone who's joining us today. So total of 90 minutes. We're going to have about an hour-long presentation with 30 minutes at the end for questions. You'll notice that all of our participants are currently muted. So near the end, we'd love for you to pop your questions in the Q&A chat, and we'll get to as many of them as we can. We'll also have a few guests joining us at the end to just share some of their experiences as well. And then a recording of this webinar will be available after the session, and you'll get an email notification about that if you'd like to share it. For those who aren't familiar with us, I just want to do a quick introduction to ActSafe. We are a health and safety association who supports British Columbia's arts and entertainment industry. We have been serving our industries by providing resources and information and education to employers, workers, and supervisors to help them achieve healthy and safe workplaces. Our vision, which I'll touch on briefly, is to have British Columbia be the safest and healthiest workplaces in the world. And how we achieve that is through our mission to prevent and eliminate workplace injury, illness, and death by providing world-class occupational health and safety, wellness, education, training, resources, and services. Just a quick note that in order to help us achieve our mission, it would be great to get feedback and insight on this webinar. We love to hear about ideas for future topics, so please do fill out the post-webinar survey, which you will get via email after we're done. I will jump quite quickly into a little bit about our host here, who is Mona Shum. Mona provides occupational and environmental health services to clients want to reduce occupational and environmental health risks in their populations. She is a certified industrial hygienist with over 25 years of experience in exposure assessment, indoor air quality investigations, chemical review, and environmental public health, which basically means she knows what she's talking about. Mona has been involved in wildfire fighter intervention studies led by the University of Alberta, and has already helped develop strategies for the film and television industry to deal with wildfire smoke and heat stress. She is currently the principal industrial hygienist at Aura Health and Safety, and she's an adjunct professor with the University of British Columbia. Before I hand her the mic, just a quick overview of our objectives for the session today. We would like participants to be able to describe the health effects associated with heat and wildfire smoke exposure, understand how occupational and public health guidelines can be utilized to develop exposure control plans, or we like to refer to them as ECPs, in our non-traditional environments that we work, and then determine applicable control options to mitigate those exposures. So our hope is that participants will be able to apply what is learned to their own situations and then mitigate exposure going forward. I will now pass the mic to Mona.
Thank you, Catherine. I'm glad to see such an interest in this topic. This is a topic near and dear to my heart. I've been working on heat stress and wildfire smoke for many years now. And as Catherine was saying, we've been working with the wildfire fighters in BC on a number of different studies. You might have seen an article about it today in the CBC News. I would first like to acknowledge a couple of my co-authors on this presentation, Michael Cooper, who is out of Idaho. He and I presented a modified presentation to the American Industrial Hygiene Conference and Exposition down in Phoenix, and also Adrian Fung, who is one of my staff who helped put together the presentation. So thanks to those two. Okay. So just to give you a little overview of where we're going today, I'm going to be talking about heat and wildfire, if you didn't get that from the title already. So we're going to talk about heat stress and wildfire smoke and how to assess it. We're going to do a bit of a comparison of different jurisdictions. It's not a full environmental scan. It's not every jurisdiction, of course, in North America. It's just giving you a little flavor of the differences, and there are a lot of differences of how people do things. And then I'm going to provide a couple of case studies on heat stress and wildfire smoke in the entertainment industry. So as we know, we're hearing and seeing the headlines about climate change. We know that every year we're getting more and more wildfires. They're happening all around the globe. Often with wildfires, there's heat too. Those go hand in hand. Oftentimes we're seeing these terms that are fairly new to me. I had never heard of a heat dome before 2021. I don't know if they're necessarily new terms, but I had never heard of them. We were in that heat dome in Lytton, actually, in 2021 when the town burned down, actually. So one of my colleagues, Taryn Toik, whom many of you may know, she was there with the wildfire fighters, the ones that actually ended up responding to that fire. But you know, she left around 2 o'clock that day, and around 6 p.m. or so, the fire started and decimated that town. So we're seeing these headlines in Australia and in Europe, all over, and in the US, and not just in the summer. So we had fires in the US in the winter as well. So they're happening more and more, and the seasons are growing longer. So I'm not going to go too much into detail about heat stress. I think we all recognize that we, as humans, as mammals, like to be in a very narrow temperature range. And if we get outside of that, bad things happen. So what can happen if we get too hot and we can't dissipate the heat is we can get things like heat cramps and rashes and dehydration and syncope, which is fainting, exhaustion, and then stroke, heat stroke, which can be a medical emergency. And I'm sure many of you have experienced some or many of these different types of health effects. I myself have experienced almost everything except luckily heat stroke. And when I was in Phoenix, actually, really ironically, we, the presenters, went out for lunch and we got lost walking around the Phoenix Convention Center. And then I said, we can't all, be hospitalized for heat exhaustion or heat stroke right before we're supposed to present on heat stress. So it was sort of ironic that all these people were out there. We're all industrial hygienists, all know about heat stress, and we're out there almost suffering from it, but luckily we managed to get in an Uber. So there's lots of different ways of assessing heat. There's lots of heat indices around the world. So there's hundreds of them actually, but these are some common ones. These are acceptable in British Columbia. So the one gold standard, I'm going to put the laser on here. The one gold standard for industrial hygienists like myself is this WBGT, the wet bulb globe temperature method, which is really getting at a wet thermometer. So what you do is you put like a cotton gauze over top of a regular thermometer, and then you have a dry thermometer, which is just a regular thermometer with nothing on it. And then you also need to look at the radiant temperature. So you have a globe thermometer as well. So this instrument here is here's the dry, here's the wet thermometer, and then here's the globe thermometer. And you do this calculation, which adds them up all together, and then you get this WBGT value. And you do things like think about what you're wearing, and you add values there, and you think about what type of activity you're doing, and you add some values there. So it's quite a robust way of assessing heat stress, and that's sort of the gold standard we use. However, as you can see, it's something probably people, the general public and others who aren't industrial hygienists would not want to use. It's not something we're going to be taking along with us in our cars and on sets or different live events and things like that. Not necessarily, at least. So there are other methods of doing heat stress assessment. There's core temperature, where you see the little baby in the middle who's getting his or her rectal temperature taken. Of course, workers don't like to get their rectal temperature taken. I myself have never had to do that. However, oral and tympanic, which is in the ear, core temperature is acceptable as well. And we have had to do that in the past when I worked for an oil and gas company, where we did confined space work, and we would go into these confined spaces and actually do quite strenuous manual labor in full TICAM suits, like fully impermeable suits with full supplied air. So of course that would add a lot of heat stress to even a air temperature of 28 degrees Celsius outside, it was a huge heat stress risk inside the confined space. So at that point, we had to do oral core temperature, and we had to make sure they had lots of breaks. We actually used things like cooling vests, et cetera, as well to try to keep them cool. Other methods, heart rate, recovering heart rate is a possibility as well. And this humidex. So that's looking at relative humidity and temperature. And we see these in the states where they have the heat index, in other countries as well, a heat index or as a feels like temperature. So what they do is they take the temperature, relative humidity and the temperature, and then they say, oh, it actually feels like it's 38 degrees instead of the dry bulb temperature of 32. That's what they're saying. And then we here in BC allow for this humidex method, which is also this idea of using relative humidity and temperature and getting this feels like temperature, but then also adding some other components to it, which make it more robust. And I'll tell you more about that in a bit. So at this point, I'd just like to ask you if you're interested in downloading this app. So this is an app that we created for IATSE 891. It's called IATSE 891 Heat Stress App. And so you can look it up on the App Store just by typing in IATSE 891 or your Google Play. And if you want to follow along with today's presentation, please feel free to do so. I normally don't tell people to look at their phones while I'm talking, but I'm going to ask you to do that right now, please. So we did a jurisdictional scan, like I said, not a comprehensive one, just to get us an idea of some differences. And we wanted to look at what are acceptable methods for looking at heat stress risk. So in BC, we talked about it already in the other slides. So the Wibjet method, the recovery heart rate and core temperature, humidex, and the dry bulb thermometer, which is just taking the dry bulb air temperature, is an acceptable method, are acceptable methods. Now, the issue with the dry bulb thermometer method is that it doesn't account for humidity, right? So you could have a dry bulb temperature that seems okay, but if you add a lot of humidity, then it's no longer okay. It could be a pretty large heat stress risk, and it depends also what you're wearing and all those sorts of things. So Ontario allows for Wibjet and humidex and also heat wave alerts. And this bottom row here is about trigger. At 23 degrees Celsius, that's what's listed in the guidelines for WorkSafe. It says you need to start thinking about heat stress. It's not that you have to do specific things necessarily, but you do need to start thinking about it. If you're over 29 degrees or 30 degrees and up for a dry bulb, you should have an ECP. However, an ECP could get triggered at lower temperatures. Just like I was saying, the dry bulb method doesn't necessarily take into account humidity. So you can have, oh, someone can't find it. So it's IATSE 891 heat stress. So Ontario also has they have different temperatures that are listed, but the lowest one I could see was a 30 degrees Celsius plus a humidex of 40 as their sort of trigger for activities. So in the states, we only had a few states in here, Washington, Oregon, and California. They allow for dry bulb in Washington, but you don't have to record the temperatures. They all talk about supervisor training. Of course, we have supervisor training that's required as well. It's just not embedded in our heat guidelines, but they all say that in their heat guidelines. Their trigger temperatures are anywhere between like 32 degrees Celsius to about 27 degrees Celsius. And then Oregon also allows for dry bulb, and Cal OSHA allows for weather reports and dry bulb as well. So that's kind of all different. So we have a table here that represents those differences. You can see sort of acceptable methods for heat stress assessment, and they're all over the map. So wildfire smoke. just wanted to talk a little bit about the different constituents of it. So wildfire smoke is made up of a whole bunch of different things: carbon dioxide, carbon monoxide, combustion smoke, which consists of different types of smoke. So char is irregular carbon particles of unburned material. These are airborne particles. Soot is that finer carbon material from incomplete combustion. And then ash is that burned cellulose material. It contains like minerals and oxides and metals. Also, there's these chemicals that can land on the surface of these carbon particles. And a lot of them are probably or are known carcinogens. So the polycyclic aromatic hydrocarbons, like benzoate-pyrene, for instance, are oftentimes on these particles. And actually, we are looking at these polycyclic aromatic hydrocarbons, or PAHs, amongst the wildfire fighters. So this summer, we're actually waiting for a fire. It's kind of strange to say this, but we're waiting for a fire within about a 5-hour driving radius from us, because we have a lot of equipment. We have a freezer that we have to bring to site, etc. So it's we're waiting for a fire in our vicinity so that we can go out and start measuring for PAHs. There's hydrocarbons in wildfire smoke. There's nitrogen oxides, sulfur oxides, volatile organic compounds, mineral acids, and trace metals as well. So it's really like a big gloopy mess of stuff in there. There's so many things. It's hard to tease out one or two constituents sometimes to see what people are being exposed to, but we do look for markers of exposure by measuring one or more of these things. So the exposure concerns from wildfire smoke, they can consist of like upper respiratory irritation and inflammatory responses, asthma triggers, and immune system suppression, changes in your lung function and your lung capacity, bronchitis, obstructive pulmonary disease, cardiac disease, and even cancer of the lung, skin, and bladder. There's been lots of studies on wildfire fighters and firefighters in general that link cancer risk. So there's susceptible populations we know of, infants and young children, people with chronic respiratory conditions, pregnant women, persons with compromised immune systems, senior citizens. So we have a number of folks that we need to be particularly worried about. And in this population of film and live events, we do have these susceptible populations, which may actually be a little different, which are a little different from what we normally deal with as occupational hygienists. We oftentimes go to, manufacturing facilities, oil and gas plants, mining, where we have a fairly healthy working population, right? So with the entertainment industry, we do have these groups that sometimes we normally don't have to consider. So I just wanted to show you what char looks like when it's under the microscope. You can actually see it. So here you can see the char particles compared to where there's no char particles. So this is a technique to identify, let's say, if char is entered into the indoor air, and you can do some sampling for it, air sampling for it. Also, we've done things like looked at surface sampling of soot, for instance, and being able to see what that soot is related to. So oftentimes people, especially in the States, they may make claims or something about wildfire coming into their homes, or fire coming into their homes and then landing on all their furniture and ruining their furniture, ruining their contents inside their homes. And so then they'll be like, well, it was this external wildfire smoke that caused this issue. And then they want to get reimbursed for it. So I was involved in one case where that was the case. They wanted to get the insurance company to pay for their belongings and their contents. And so I went in there and did some surface sampling, and then you can analyze the soot under a scanning electron microscope, and you can actually see the soot associated with other particles that are stuck to it. We could see that the soot was associated with this canuba wax. And they were using these wax candles all over the house. They were lighting candles in all the rooms. And so we were able to determine that, in fact, it was actually coming from within, and they were causing the source of the soot that was landing on all their belongings. So it's really interesting when you do sort of that forensic analysis, and you can do that with some good microscopy. So in terms of wildfire smoke in air, though, people often ask us, well, what's bad? What's too much smoke? Can we no longer film outdoors? Can we no longer do this large event outdoors? Oftentimes I would get calls like on a weekend or something, and people would start to think about it the day of. They'd be like, oh, it's smoky today. What do I do, Mona? And oftentimes they're like, oh, well, should have planned ahead, first of all. But what we turn to is like these air quality indices, because there aren't any occupational exposure limits in terms of wildfire smoke. So in BC, we have this air quality health index. In the US, they have this air quality index. And so in different countries, they have something very similar, and you can look them up. They have different scales, though. So if you really want to know more about them, you can look them up a little bit more. But essentially, the AQHI in BC has a scale of 1 to 10. US EPA has a scale of 0 to 500, and it also then categorizes them into 6 levels of good to hazardous. The contaminants are the same. We're looking at ozone, PM 2.5 and 10, nitrogen dioxide and sulfur dioxide. So they're often the same. All these global indices around the world are often looking at the same types of contaminants, different rating scales, though. So we need to pay attention to those. So as I was saying, these occupational exposure limits are lacking. So we do rely on these ambient air quality standards. And, the ambient air quality standards are for the general public. In this case, might be very fitting for some of the vulnerable populations that we're dealing with, right? What is lucky about BC is we actually have a wildfire smoke specific ambient air quality standard. So when it gets smoky, the government says, hey, we're going to start to use this AQHI plus, which is like the AQHI on steroids, I guess. They use the T.5, PM 2.5 measurements, and then they give it an AQHI. So this is the chart that they have here. So you can see the actual concentrations of in micrograms per cubic meter of PM 2.5. They relate to an AQHI rating between 1 and 10 and 10 plus. And then they actually categorize them into categories of risk, AQHI risk low, moderate, high, very high. And you'll see here they actually have 2 health messages. So one for people at higher risk, and then one for the general population. So for instance, at a high level here, it says to the higher risk folks, you need to reduce or reschedule your activities outdoors, strenuous activities outdoors. Whereas for the general population, it's not saying that you shouldn't, but you should consider rescheduling your activities. So they have these for the public. What we're trying to do is have something for the workplace, right? So I recently was asked a couple of weeks ago, what should we be doing at each of these AQHI levels, for our workplace? What kind of controls should we be using? Because these are great, but they're for the public, right? These here actions to reduce wildfire smoke exposure, these controls, they're good for workplaces as well, right? So they're talking about using a portable air cleaner. They're talking about staying indoors when you can, visiting places with cleaner air. And then if you can't access cleaner air, then using like an N95 respirator, that sort of thing. So these are actions that we can take as well, but it all really depends on the action that we want to take in the workplace. So now I'll just move on to a couple of case studies in the entertainment industry, talking about heat stress risks on set. We have been involved in a few cases where the production itself is producing the heat stress. So we've been involved in, for instance, effects like fire on set. And so my colleague and I, Taryn, we went out to one set where the actors were supposed to be in amongst this fire for extended periods of time, like just surrounded by fire. And so we went in there with one of those Wibjet machines, the wet bulb globe temperature machines, and we actually had like infrared thermometers as well, and we're just going in, like our surface is getting really hot, our my pants actually got to 70 degrees Celsius, I remember. It was pretty hot. So anyways, we figured out what the wet bulb globe temperature was and figured out what people were wearing, how long they could be there. And we had some controls around the heat stress, but that was produced on set, right? Most of the heat stress risk we're seeing is coming from an external source. It's global warming, whatever you want to call it. It's our weather that's causing the issue. So in that case, it's how the production interacts with that environment, right? So what you're wearing is really important. My sister is a film director, and she worked on the Murdoch Mysteries in Toronto in the middle of July. And of course, it's set in the early 1900s. So people were pretending to be in winter at the time, and they were wearing big like petticoats and overcoats, etc. in July, in August, July, in Toronto. And they had to deal with heat stress on set. It was pretty intense. Of course, live events, you have also heat generated at the event, such as in cooking here in this picture here, as well as external heat. We have been asked in the past to look out at the P&E every August. Of course, it can get pretty hot, and then people are cooking inside these small little food trucks, etc. And it can get really, really warm in these environments, and people are pretty active in them too. So not just for the workers, of course, the general public, you have people in crowds out in the sun. So I was out at an event, and it wasn't even that hot. It was April, end of April, and there was someone sitting in the front in the sun, directly in the sun, for about 2 hours, and then they fainted. And the first aid attendant who came was saying this happens all the time. So it is an issue that live events need to face as well, and more so now. So I just wanted to talk about the Humidex method, because the app that we produced uses this method. So what it is, it's a translation of the Wibjet method into Humidex values. It's actually probably the closest thing you can get to doing a widget without doing a widget. So what you do is you find the Humidex value using the relative humidity and temperature using this kind of chart. And you can measure that relative humidity using a hygrometer like this one, like a digital one. Or you use a sling psychrometer, which I only ever used back in school, but it's like a thermometer with a wet wick on it, and then a thermometer with nothing on it, and you swing it around, and then you get the temperatures, and there's these charts, these psychrometric charts you can use to figure out the relative humidity. So the Humidex method cannot be used when there's like an infrared direct heat source from industrial equipment or hot surfaces, and it cannot be used when you're in an environment that has industrially produced high humidity levels. So like a pulp and paper mill, for instance. What it does do, though, it actually considers things like your work clothing. What are you wearing? Are you allowing for sweat evaporation? It also takes into account radiant heat, indirect sunlight, and one thing about WorkSafe guidelines, it says you need to take these measurements at the work site. You cannot just rely on the weather stations and things like that. So it needs to be localized. So what the WorkSafe guidelines say with the Humidex method is we have two different sort of Humidex ratings. One side is actually for unacclimatized workers. And here you see you have like lower ratings on this side, whereas acclimatized and light work, like light activity work, you can have a higher level of exposure, and then you have the same sort of response or control. So that makes sense, because if you're sitting down and you're not doing much activity, you're allowed to be a little warmer than someone who is doing manual labor and getting really hot, etc. So there are some heat stress apps out there. So many of you might know about the OSHA heat safety tool. So this is one where it looks at temperature and relative humidity and gives you like a feels like temperature. So there's also this new one now that we developed with IATSE 891 with the Humidex method. So the heat index method with the OSHA tool is really quite nice. It gives you schedules reminders. It's in English and Spanish. It gives you education and risk factors, signs and symptoms, and even first aid information. It allows for either local temperature and humidity to be put in using phone location. So it does allow for you to use your weather app, for instance, and it gives you this feels like temperature and humidity, and gives you a risk category and then precautions to take. So the IATSE app has that first bit as well. So you can see the OSHA tool sort of ends at this level. What's different too is our app says you need to have a hygrometer or some way to get your own temperature and relative humidity at your site. So that's OSHA's tool sort of ends here, gives you a feels like temperature, whereas the IATSE tool actually keeps going and it asks you about clothing, work intensity, radiant heat. Acclimatization actually is not asked here, although it's built into the app, because IATSE was saying we just want to default to unacclimatized workers, because for the most part in Vancouver and Lower Mainland, we don't ever really get acclimatized. So we just took that question out. And then it gives you this Humidex 1 or 2 value, and then gives you a response. So right now, I invite you all to open the app and sort of follow along as we go through. And you don't have to if you don't have a phone. I don't know who doesn't have a phone, but if you don't want to follow along, you don't have to follow along. I will explain as we go through, but it'd be nice if you did sort of follow along. So you can actually go into background. I'm going to actually follow along myself. And you can take a look at where this app came from and, a little bit about it. You can actually read some technical details about it too, if you're really curious about how we came up with our assumptions and things like that. And then you can go to the assessment. And the first thing we have to do is say that we're not in these conditions. So you're not in no sources of direct infrared heat coming from industrial sources, no really high humidity levels from a pulp and paper mill, and you're not wearing impermeable or semi-impervious clothing. So this clothing that the Breaking Bad boys are wearing right now, you cannot be wearing that. So unfortunately for them, they cannot use the app, the heat stress app. So then if you go to the next one, you click all the boxes and you go to the next screen, you'll see a temperature, or sorry, location. So if you go into location, you can put down where you are. And this helps because at the very end, there's this screen that shows where you are and what time you did this assessment. So you can actually screenshot it. So it's a nice thing. So please put in something about where you are. It can be anything. And then your temperature. So put in your temperature that you're at, or you can guess as to what you're at, and then the relative humidity, you can put in that, and then you can keep going. It can be, the temperature can be done in Celsius or Fahrenheit for our American friends. And then it asks about clothing. And I get a lot of comments about this one, and they say, well, why don't you have more clothing that's pertinent to the entertainment industry? We don't often wear coveralls and things like that. And the reason why it's kept this way is because it's in the WorkSafe guidelines. We didn't want to stray from that because these clothing items have real evidence to provide an additional number of degrees, right? So you're adding 5 degrees Celsius for coveralls over summer clothes. People have done a lot of research on that, and WorkSafe is agreeing to that, right? So I didn't want to sort of go, oh, well, coveralls are similar to, overcoat. I didn't want to make that decision, but we are asking you to use your best judgment. So for these characters here, I want you to go through one of them or more of them and just kind of choose a character and say, hey, what do you think? Are they wearing coveralls over summer clothes? Would you consider like a hard hat or a hat to be similar? Gloves, vests. Summer clothes are considered light clothing, light shirt, light shirt, pants, socks, underwear, and shoes. So anything more than that would be considered an addition. Someone's asking for a link. I don't know if Lisa and others can assist. Okay, so anyways, then we have if you want to choose one, like let's say the lion here, you know, they're probably what I would consider wearing coveralls over summer clothes and a hat too, and gloves. So pretty much almost everything I would put on there. But someone like Dorothy here, she's just wearing summer clothes. She's wearing a dress, it's pretty light. So in that case, that's what I would choose for that. The Tin Man though, he's wearing impervious clothing, right? So this one I would say you can't use. Tin Man cannot use this heat stress app. And then for this crew, let's do that again with the crew. So this is probably more like what we'd see. So most of people are wearing light clothing, you can see here. So just summer clothes, but then some of them are wearing hats. So I probably would add in a hard hat for them as well. And I don't know if anyone's wearing a vest, but probably those two for this picture here. And for this one, they actually are wearing hard hats. So we can actually put hard hat in here and summer clothes. So let's move on to the next one, which is really asking about, are you in direct sunlight or an indoor area with radiant heat? And that could be high powered lighting as well. So that's really pertinent for people who are like in the entertainment industry, on production, etc. So you can say yes or no. And then it talks a bit about your activity level. So are you resting? Are you just doing some sitting with some manual work? Or are you running? You know, are you doing something at maximum capacity? So there's a sliding scale you can utilize from light to very heavy, and you can choose which activity level you're doing. And then for something like this, for Agent Smith and Mr. Anderson, what would you consider they're doing? Are they doing heavy, very heavy? I'd say somewhere in between there, one of those. And then this person, definitely light sitting with a little bit of manual light work with the arms. This person, similar sitting, but kind of moving around a little bit. And then you can edit. So you go to the next page and then you can edit anything you want. You can go in here. This is where I've sometimes played with the app to check things. It's really simple to just press that little pencil and then go and change it, change the temperature, change the relative humidity, and then do it again, generate a report. And so then what it does, it generates this screenshot. And what I was saying before is that location is located here. And it also tells you about the date and the time. So this is important because WorkSafe wants you to do hourly readings. So you can actually use this screenshot and use it every hour and then use it as a bit of a reporting structure. So what it does is it gives you the heat stress risk, it tells you if it's high or not, and it gives you what to do. Also, there's a website that it goes to, and it'll pop up this IATSE 891, how to report unsafe work, and you can go in there for more information. So those controls that you noted there were actually just from WorkSafe BC. So we've just included these controls here for the different humidex ratings. So really, it's a quick and easy screening tool. It can only be used under certain conditions. But of course, you never ignore your heat stress symptoms, even if it says the heat stress app says it's low. risk. You should never ignore your symptoms. And it also requires some education and training around it. So I know that IATSE 891 has purchased 200 of these hygrometers. They got them off Amazon. We helped choose them for them. They actually branded them, etc. too, and they're providing it to their members. So we're going to move on to wildfire smoke now. I know some of you indicated you're having some questions or issues with that. We can address those after the session. So wildfire smoke. So in BC, it's mostly a summer issue. Like I was saying, in other places, though, it's not just a summer issue anymore. And of course, it affects not only outdoor filming and live events, but also indoor. And at times we have these vulnerable populations. And like I was saying before, there's no clear occupational guidelines or limits. So we were asked actually to put together some heat stress and wildfire smoke exposure control plans. And as for heat stress plans, ACSAFE has a nice template available on their website where you can download a Word document that you can actually modify. And that it's a really nice sort of basics of what goes into an exposure control plan for heat. For wildfire smoke, it's not really something that people are doing much of right now, but I was asked by production to do that for them. And that's where we came up with all the AQHI and looked at different levels and controls that they would do at certain AQHI readings. So this is just an example of what that exposure control plan had. So they had some actions that were required when AQHI was 7 or greater. So of course, every production might have different needs and different actions, but they had certain things that they had to implement at that time. So how do you get at this current air quality information? So I'm going to ask everyone to go to their weather app on their phones. And you can actually find a lot of information on the weather app itself. So if you were to go into, I'm in Vancouver right now, Burnaby, you'll see a screen like this, right? And just look for the air quality section, which is right below all the temperatures. So you can see here, it'll say, today I'm seeing 2 low risk. And then you click into that. And if you click into that, you'll get into the next screen, which is a black screen. And then it'll actually say the air quality index is X, which is better than yesterday or worse than yesterday. It'll say it's ideal air quality for activities, outdoor activities. And then they'll also say what the main contaminant is. So it's nitrogen oxides today, typically coming from traffic. So that's really good information. If you looked up another country, so if you looked up America somewhere, Phoenix, I was in Phoenix, you can do that too, and you can see the air quality index comes up. So it's a different scale. And if you looked up Beijing, you would see a different scale there too. But all of the weather app is great for giving you some real simple summary information. You can also download the actual apps for each of those indices. So the Air Now for the EPA AQI, you can do that. You can download a separate app for that. You can download a separate app for AQHI and get more information from WeatherCan. But really what it's about is thinking about AQHI and thinking about how we're going to deal with wildfire smoke ahead of time. So when we're doing these call sheets, for instance, for productions, we might want to consider AQHI. I know right now we talk about a lot of people have weather on there, like temperature, and they'll have conditions, whether it's cloudy or sunny, etc. Maybe we need to add AQHI to those call sheets. For this production in particular, they wanted to also do some direct reading measurements. So they wanted to use something like this, like a dust track, to actually measure the PM 2.5 when it was smoky. There's different tools you can use, like this direct reading instrument, and then you can compare to the PM 2.5 levels that are given in the AQHI plus chart here, and you can go, oh, okay, well, you can compare, and you say, oh, I'm getting, let's say, 65 micrograms per cubic meter. That falls in here. That's a 7. That's a high risk. And then for me, I have a plan already created at 7. We are going to start implementing this, that, and that. and they can be specific to your workplace. There's also other tools for helping with assessing the air quality. So we have this BC Wildfire Service app on our phones. We're noting where all the fires are because we want to be able to determine whether there's a fire creeping up in our vicinity. So we're kind of watching that quite closely. But if you're doing a production or a live event somewhere, you may want to look at this wildfire map just to see where all the wildfires are and whether they're in close proximity to you. There's also other websites you can go to, like the govbc.ca. They have information on PM 2.5. So you can actually look up PM 2.5 and you can find a whole bunch of little dots, and you can actually say, these are the, look at them and look and see where the air stations are. So there's a number of different methods for looking at AQHI. You can actually do this routine monitoring with a real monitor, but there's strengths and weaknesses to doing that as well. So we want to make sure that we consider those strengths and limitations, right? So routine monitoring is great because you're actually doing it at the place of work. Remote sensing, relying on some of those air monitoring stations, that can be helpful as well, but it might not give you right where you're at. It might be at different elevations and things like that, so it might not be exactly what you're experiencing, but it's probably a good way of screening. And then forecast modeling is trying to predict where the fire is going to be going. That's a little harder. You need some expertise to be able to do that, but people sometimes need to do that when they're predicting where they're going to be putting a production or putting a live event and things like that. Fire proximity or smoke fire information, where I was talking about the BC wildfire map. That one's a good one just to see where the fires are. It's not really proportional to smoke, and we don't know which direction it's going in and all those sorts of things. There's a number of different things you'd have to look at other than just proximity to wildfire. But then there's also this smoke proxy or visibility range, which we are actually going to be using in this season for wildfire fighting. We actually are going to be asking the wildfire fighters to look at the smoke around them and give us a scale. So we have a scale that we set up, and then we're also going to be measuring real particulate levels. So we'll be able to hopefully say, when they say it's really smoky, this is the range of particulate that we're getting. So we'll have some kind of visibility scale. Now, this isn't very useful on different types of days, on when in nighttime, when it's dark. Also, relative humidity and sort of how wet things are will affect the visibility ratings. So for wildfire smoke controls, well, we can't quite eliminate the wildfires, not ourselves at least, but we can try to get away from it. So eliminate the issue by getting away from it. So maybe we can find a different location away from the smoke to do our work. Maybe we can reschedule outdoor work. For engineering controls, perhaps we can provide some enclosed structures or vehicles where the air is filtered, reduce time spent outside, reduce intensity of the work outside. And then potentially use N95 respirators or other types of respirators if the work can't be readjusted or rescheduled. But of course, if you're going to do that, you'll need a respiratory protection program and all the education and training required there. But just because you're not outdoors doesn't mean you don't get exposure to smoke. You could get indoor exposure to smoke from infiltration. So we're often asked to sample indoors. Well, hey, is the smoke coming? Well, we can smell the smoke coming in. Is it bad for us? And so they ask us to do some measurements. And so there are certain things we can measure, but certain things we can't. So for temperature and relative humidity, for like heat and things like that, we can definitely do that and see what the comfort levels are. We can measure things like CO2 and carbon monoxide. We can measure volatile organic compounds and even fire-specific volatile organic compounds. Now, usually it's not a cheap thing to do, and it's not a quick thing to do if you're looking at fire VOC markers. We can also look at particles themselves. We can look at PM 2.5 and PM4 and PM10 and see what the concentrations are indoors to see if they they're above limits and things like that. Again, we can look at vegetative char and soot and ash. We can look at the type of combustion and determine whether that air is coming in with smoke in it. So there's different pathways, and of course we know the common ones, which are your windows and doors, but also we don't think about it, but foot traffic, you could bring in particulate from shoes and clothing as well. You can get a lot of sort of leakage in your building. So in the summertime in buildings, we have what's called a stack effect. So heat will rise, right? So warm air will rise. So so what happens with that in a building, you'll get heat rising, and it causes this suction of air from the lower parts of the building. So any kind of holes or any kind of leaky areas that you have, that air is coming in and going up and out, right? So it's doing this, what's called the stack effect, and therefore you're bringing in a lot of unconditioned air. So hot air, possibly, and smoky air that's not at all filtered or conditioned. So that is an issue, especially for residential homes, but also for workplaces as well that don't have proper mechanical systems, which oftentimes I know in the film industry, we utilize warehouses and things like that. So they can be leaky, doors are opened all the time. So air can come in, and it's difficult sometimes to deal with both the heat and the wildfire, because sometimes those two are contradictory to each other, right? We want to keep, we want to bring in, you don't want to bring in wildfire smoke, right? But you might want to bring in some cooler air to cool the indoors. And so those things are sort of contradictory sometimes. HVAC air intakes can also bring in smoke, especially if there are no filters or not adequate filters. If they have very coarse filters, they can bring in smoke. Leaks in the units as well can bring in smoke. So people ask us all the time, is it safe? Is it safe inside then? And it's a difficult question to answer. So unfortunately, there's no one chemical or particulate test you can do to determine if the building is safe or unsafe or will cause health effects in a given facility. However, you can collect data to sort of say what's there and how much there is, and we can look at what levels we can compare it to. And then we can also look at sort of remediation or cleaning effectiveness. So we can actually say, okay, well, we were involved in, for instance, like a warehouse that was having an issue, and they said all the smoke came in, and we smell the smoke, and it seems to be affected our warehouse materials. So, you know, after they cleaned up and after they were able to flush the air, etc., you can come in and do another test, and you can see that it's much cleaner. Now, what are the standards around that? That's another question. So sometimes it's difficult to answer this question about safe versus unsafe. And a lot of times experience and professional judgment must be applied. So here are some things for controls. So we don't want to open unfiltered HVAC air intake dampers. We don't want to do that in a wildfire smoke situation. In that case, we'd want to close them. But then, of course, that causes issues too with getting enough fresh air. We want to keep windows closed. However, if you do have an HVAC fan with a good filter on the HVAC unit, then we do want to bring in that clean air through that filter, and you want to bring in that fresh air. You can use portable indoor HEPA cleaners as well to try to clean the air. They need to have the capacity for the area that you're looking for. So oftentimes I'll see little HEPA filters on people's desks and things like that, and that's not doing much. It's not cleaning the room's air. So we do need to be cognizant of that, of the clean air delivery rate. And sometimes when you look at those ratings, just be aware that those clean air delivery rates are oftentimes tested at the maximum setting. So it's the loudest setting, and usually people don't like that, and they turn it to like a lower or medium setting, and then you're not getting that actually advertised clean air delivery rate. And sometimes you're not getting that clean air delivery rate anyways. Like we've tested a bunch of these units before that claim to be a certain level, and they're not. So we do have to be careful about which HEPA filters we do buy if we're going to buy them. And running wall-mounted air conditioners don't do anything because it's just bringing in air from outdoors and cooling it with no filtration. So in general, in conclusion, we know we need to deal with these new hazards, right? Heat and wildfire are not going away. We need to deal with these risks that are not generated in the workplace most of the time. So it's kind of different from an industrial hygiene perspective. We need to use our risk assessment lens in a slightly different way for a different population, right? And because sometimes we don't have guidelines or sometimes we don't have regulation, we have to kind of find applicable guidelines for us. And different jurisdictions are doing different things. So it's sometimes a little confusing what works best. But we do know there are some digital tools that are available to us to assist us. And we do know that people are thinking about this issue and trying to do more around this emerging topic. So we need to share what we're doing. We need to share our best practices. We need to collaborate. And I'm not saying I have all the answers, but this is, just sharing my experience with these two areas. And most importantly, we need to plan ahead. I need the Saturday morning emergency phone calls to stop where they call me in the morning going, it's okay today, we're filming today, what do I do? Which is oftentimes, I mean, I'm glad to take those calls. I'm joking, half joking. I'm glad to take those calls, but it would be great if we could go, hey, ahead of time, we're going to be putting together a plan. We know what we're going to do. When the AQHI gets to this level, we are going to start enacting these controls or these actions. That would be the ideal, right? And so that's what I'm proposing we do, that we all think about a heat stress plan. We all think about a wildfire smoke plan. So for more information, there's some great fact sheets out there. WorkSafe BC has one. BC CDC has a lot. They're meant for the public, but they have a lot of fact sheets on various issues around wildfire smoke. And then ActSafe has this heat stress ECP template, which you should check out as well. And so I'd like to thank all of you for listening today. There's my information. People are welcome to contact me with questions. I also have a podcast that came out about a couple months ago on a new normal of hot and smoky environments. So again, love to talk to you more about heat and wildfire smoke. So now I'm going to open it up, I guess, to our panelists, and they can share some of their experiences. I was hoping Keith could speak, and Keith's from New York and from the live theater industry. So Keith, would you mind speaking about some of your experience with heat and wildfire exposure?
Sure, I don't mind at all. Back on Wednesday, June 7th, if you don't remember, that was the day New York turned yellow, orange, all different colors that we don't usually see. We work with the industry for live theater off Broadway and Broadway, regional theaters here in New York City and the surrounding areas. And that day was a two-show day because, lucky us, Wednesday matinees happened. And so we were getting started with this issue very early on in the day, because I think around 3 o'clock is when I think it might have hit the highest AQI here in New York City. And I think was one of the worst in the world at that time. So all our shows were heading in and getting started, and usually the AC is not on. And so the HVAC was turned on around, say, 12:30 here in the East. And I don't think a lot of theaters thought about, as Mona just pointed out to us in terms of some controls, was closing those dampers on the HVAC intake. And so we started getting calls, emails, any way you can communicate, social media from our industry saying that it smells like smoke in Act 2. And it was very hard for the industry to work. And there was also a concern about what was going to happen in the evening shows. So word was trying to get out across the New York City area that, close those dampeners, and hopefully, circulate the air enough so that the evening show was not going to be too bad. And it seems like the evening shows went well, and were able to happen. And although some shows decided not to go on because of the way the day was going already. So that really was the situation that we had to deal with here in New York City on that particular day.
Thanks, Keith. That's really interesting. I wonder if we could open up to Anit and Brian from Warner Brothers to
Yeah,
speak.
so I'm Brian. I'm with Warner Brothers Safety. It's nice to see everyone. So I'll just maybe go over kind of how we're tackling the whole heat stress thing. It's been a bit of a challenge over the past couple of years with the heat getting hot, or the days getting hotter and hotter, it seems. But sort of how we tackle it is we have an exposure control plan, which really points us in like three directions, three sort of deliverables of like training, monitoring, and our controls. So how we sort of do it is, first thing we do is the training. So we'll sit down with the production and we have a PowerPoint presentation that we'll go over with them, talking about different types of heat illness, symptoms, reporting. Talk about heat stress, heat exhaustion, heat stroke, and they're trying to educate the production on these sorts of things. And then we'll go over things like risk factors, environmental risk factors, personal risk factors, acclimatization, that sort of thing. And then a few things we can do to prevent heat illness or heat related illness. So what we'll do is we'll sit down with the production, go over it with them, and then we'll ask the heads of departments to deliver this presentation to all their workers. So all the workers are kind of educated in heat stress before it gets hot, like Mona was saying. It's important to get the stuff done before, the day when it's 32 degrees and everyone's scrambling to figure out what to do. So this is really the education part of it, where we inform the workers what they can expect, things to look out for, that sort of thing. And then the second bit is the monitoring. So we use the Humidex method. So like Mona said, what we did is we decided on our productions anyway to get a hygrometer that has like 4 or 5 different monitors on it, and it's connected to one central hub. So we can set these monitors up at different locations where we have people working, and you can monitor it all from one central hub. So it has the temperature, the humidity, and the Humidex value on it. So the biggest issue we had with that was trying to figure out how to communicate that to everyone when Humidex does go up to, say, 38, and we have to let everyone know they have to have a 15-minute work rest cycle, that sort of thing, right? So what we kind of decided to do, and what was really working well for us, is we had one person monitoring the monitor, I guess. And then when it would get to that level where we had to introduce something, that person, whether it be first aid or the production coordinator, whatever made sense on the day, they would notify the production office. The production office would notify the heads of department on what they need to do, whether it's inform workers they need to drink more water, they need to take work rest cycles, get some shade, that sort of thing. So depending on what the Humidex value responses were, we would communicate that to the heads of department, and the heads of department would communicate that to the workers on what they need to do. So really, for us, it was about, figuring out ways such as like water, shade, cooling tents, that sort of thing. Those are the big ones that people are always looking for, right? And then it goes into the work rest cycle. So the thing that I think a lot of people got confused of when this first came in with the work rest cycle was, holy smokes, like we can only work 30 minutes and we have to take a 30-minute break. Like, how is that going to work with production? But really, how Worksite defines it is it's that 30 minutes of work, and then you're not going to specifically take a break, but you're going to do less intense work in shade. So you can still work, it's just not going to be as intense and in the shade. So it's important to understand that we can still, work and film as we do. It's just we have to look after our people. So that's sort of how we've been tackling it. It's been working great. And we'll see how this season goes. We haven't had a chance to use that app yet. I'd be interested in seeing how that works. And I saw a question in the chat about why is this being put on the worker to monitor, and I don't think that's the intent of the app, is to have it.
No.
Yeah, so it could help productions, but really we still have that requirement of monitoring specific locations, which I don't think that app is able to do. But I think it's good for the worker to know what they maybe can expect if they put in all those numbers, right? So
Right.
I'd be interested in using that app and seeing how it works, and letting our crews know it's available for them, so you're not sort of left in the dark, just kind of trusting what someone else is saying. So, and I think I'll pass it over to Nate to talk about our wildfire.
Hi everyone. I'm Anita and also with Warner Brothers Safety. So with wildfire smoke, we've encountered it over the past couple years now, and we have had productions work last year outdoors when it was, in the higher air quality index levels. What makes it difficult with wildfire smoke is we don't have as good WorkSafe BC regulations or guidelines as heat stress. So with heat stress program, we can really rely on those guidelines and regulations. But for wildfire smoke, we really rely on the BC Air Quality Index, the one that I was talking about, the AQHI. Our biggest thing is getting ahead, like Mona mentioned, planning ahead and communicating the key health messages to production. So we're not waiting to the level where workers have to go online and start checking at health messages. We really try to make sure that we have regular notifications going out to production and all the cast and crew where we're at in terms of, the AQHI index, what are the health messages, what levels we're at, and what kind of controls production should be implementing, but also people sort of adopting. So whether that's rescheduling, work is not always easy with production schedules. So that really requires planning ahead at the beginning of summer almost, especially for features. And then, taking the adequate breaks, whether that's making N95s available for voluntary use. We haven't gotten to the level where we've made N95s mandatory. And of course, like Mona mentioned, that would require a respiratory protection program, fit testing everyone. That's going to be quite robust. So we've sort of, been able to reschedule work when it gets to the 7 to 10 very high. In terms of regulatory compliance, the main regulation, as I understand it, that applies in terms of wildfire smoke is the 5.54 exposure control plan. So having an exposure control plan, and when we're in the process of filling out that exposure control plan, we managed to sort of hit that, compliance requirement, and also have a plan that we can implement that works for production. So for wildfire smoke, this presentation was great, and we're hoping that there's more resources and more sort of guidelines that are going to come in the future, so that we have very clear guidance on what to do at what levels. And then the high risk versus, normal population, we really communicate that message that if there's anyone experiencing any kind of, health conditions, or anyone with health conditions, they take extra precaution.
Thank you. That's excellent, Keith, Brian, and Anit. Thanks for sharing your stories. Unfortunately, I can't ask the participants to speak up because of the confines of Zoom, but if you wouldn't mind sharing your stories on the chat, I'd be happy to look at them. We can read them out. And then I guess at this point, we'll take questions too.
Yeah, I just have a few questions in the chat for you, Mona. Marlo asked, what are recommended home or room cleaners? And I think this is related to probably wildfire smoke.
Right. I actually have a few. I was asked by a large studio during COVID, actually, to put together a list of reputable HEPA cleaners that are true HEPA, because sometimes they're not true HEPA. So I don't have that list in my head right now, but I can share with ActSafe. I can give you that list. And I don't know if some of those manufacturers are still around or not, but I can give you that list that we put together for COVID reasons, and anything that we look for COVID would be good for wildfire as well. Yeah. So I can follow up on that one. I just want to get back to that other question what Brian was mentioning. It is the employer's responsibility to do this, these measurements, but this is a good screening tool for members and other people who could bring it to their JOHS or their supervisor to ask questions about if they're seeing something on set and nothing's happening. Okay.
Verifying that one as well, Mona. There's another question. Is there a heat index temperature that WorkSafe shuts down work? So this is a bit of a complicated answer, I'm imagining, and I'll probably put Dagan on the spot for it. And similarly, is there an AQHI index that stops work, even if someone's wearing PPE? I don't know who wants to take it. Mona unmuted, so maybe you're off the hook. Go ahead, Mona.
Well, I'll just answer the first one.
Yeah.
Which is, so it depends on the Humidex 1 or Humidex 2, but you can go over 45 and over and 50 and over. It says medically supervised work only. So really, you're not supposed to work unless you have medical supervision at that point. So I think at that point, if like I can't speak for WorkSafe, but I think if it were that hot and you didn't have all those controls in place, they could shut you down at any time. You know what I mean? Like if you're at like a moderate level, but you don't have anything in place, people suffering from heat stress. So I think it's very dependent on when they can actually shut you down. But under the guidelines for Humidex, it does have these ratings where it says medically supervised work only. So
Thank you.
as for the wildfire smoke, I'm not aware of, I wish we had a WorkSafe person or someone on the line taken. I'm not aware of what that level would be or if they would do that.
Nor I don't have a specific answer for that, unfortunately.
I think as per what Anit mentioned is that those regulations are sort of coming into play slowly because this is new and ever evolving. And I think it's still being worked on. I think that's why understanding sort of what those exposure controls are is really important. As always, if people are feeling unsafe, that's when you would turn to your supervisor and let them know that you had concerns. There was another question, I think, Mona, you sort of clarified it, but verification that the app isn't a replacement for on-site measurements. It's just an evaluation. So just clarify that question.
Yeah, so you are using a hygrometer and you're taking measurements at your local site. So that does meet compliance. But because members are doing it, it's not their responsibility, right? It's the employer's responsibility. So the employer would go out and do their own measurements, hourly measurements, and record it and all of those things and act upon them, right? It's not up to the member or the worker to do that, but they can at least alert their supervisor, JOHS committee to an issue if they're not seeing any action on production. That's really the utility of this tool. And that, for instance, the union stewards are going out and unfortunately there's not many productions going on right now, but the idea was the union stewards would also be going out to sets and kind of just getting a screening and going, hey, it's getting up there. What are we doing, on sets? So.
Thanks, Mona. And then we have another question sort of from the live music outdoor event community here. And we sort of touched on this already. He's asking, what is the measurement generally accepted regarding smoke levels to move an event or cancel an event?
Well, so I don't know that answer either. I mean, when we look at the AQHI, you'll see the 10 plus, that's when it's pretty high and we should all kind of go indoors. But that's why for the live event or for the company, they need to plan ahead of time and go, what are we going to do at these levels? So at 7, what are you going to do, right? It's in the higher category. What are you going to do? Are you going to, at that point, start to think about moving it at 10 plus? Are you going to stick thinking about moving it? I don't think I have an answer to that. It's really what Anit was saying. There are no real guidelines out there. You have to kind of take all the information that you can and come up with your own plan about what you want to do.
And we did have a reply from one of the participants that said, last time I called WorkSafe in extreme smoke levels, they advised it's about monitoring the worker. And if the worker indicates that they can't work, then that has to be respected, which is a good point and a good follow-up. There was a question from Teresa. Following the 4th year in the US, the AQI in the number of major cities was higher. Do pyrotechnics and fireworks impact levels in long-term ways that should be monitored?
This is really interesting because when I was working at the National Collaborating Center for Environmental Health, which is out of the BC Center for Disease Control, we looked at pyrotechnics and fireworks and things like that. And of course, we all enjoy them. Well, not everyone, but I enjoy them. But they are very polluting, right? High levels of particulate. And so people, we noted when we were at the BC CDC that vulnerable populations could be affected by that smoke, depending on also the wind direction, etc. So I was actually here across the street at Central Park watching the fireworks on July 1st, and I started getting particulate in my eye. Like I was so close. that the particulate started to fall. It started like just a little bit of char getting into my eye. And my mother put on a mask actually at that time because we could start to smell it. So it is an issue. And when we were looking at it, we were thinking like, should there be some kind of, what should we do about that from a public health perspective? You know, should we start issuing guidelines or guidance around pyrotechnics? And because at the end too, they had, it was very interesting. They had, you know, the fireworks at the very end, they often do the final little bit where everything just explodes, right? We've all seen that. And it's super smoky. And then they had a mushroom cloud of fire that shot out at the end too. So it was amazing. It was spectacular, but so much smoke in that area that sort of hung in that space. So you can imagine if you're close to a PM 2.5 monitor of some sort, you're going to get those spikes. You're going to see those spikes, especially if like the whole country is doing that. It'll probably impact some of those PM 2.5 monitors, at least transiently. But I don't know what we can do about that. That's a larger conversation for public health as to what we do and how we regulate that sort of activity.
A question, are the carcinogenic particles in wildfire smoke caused by the fire suppressant foams, or are they naturally occurring?
They're naturally occurring. So the fire foams are a different thing, but the firefighters actually in wildfire, they don't use foams. They're either they're using some water suppression, but they're oftentimes just digging trenches and digging a zone around the fire and letting it burn, or they're burning fires going towards the fires, so they counter burn, right? So that's how they're doing it. So all the PAHs are coming from the natural burning of the foliage. Now, I often say, you know how we're not supposed to eat charred meat on barbecues? Like we've all heard that, right? Most of us enjoy the charred meat a little bit of browning. It's good. But essentially that charred meat has those PAHs in it. That's why we're not supposed to eat them, because they are carcinogenic. So that, if you can imagine, that charred stuff is getting into the air. We're breathing it in when we're in a wildfire smoke situation. So, and those are ALERA substances, which are as low as reasonably achievable. Like many of the PAHs are those. So we should keep them as low as we can and try not to breathe those in and try not to eat them. Although I know it's hard not to eat unbrowned barbecue meat. Like why bother, right? So, but anyways, I understand that, but you know, just keeping it to minimum.
Do you mind clarifying, Mona, a little bit with regards to medical supervision? I think the question here is in regards to first aid and how many attendants would be required if we're reaching a high level in terms of heat exposure and to carry on working.
I don't know if I have a number for that. I'd have to do a bit more research. I just know that when we had that example I gave you when I worked at the oil and gas company, where we went into confined space, we had a nurse, an occupational health nurse, that was there taking core temperatures, making sure that the core temperature didn't rise too high, right? So we were doing that, and they were coming out and taking long breaks. I think they were only working very, very short periods in the confined space, coming out, taking breaks, taking off their full PPE, getting rest in a cool environment, drinking lots of water, getting their core temperature taken by an occupational health nurse. That's just my experience with it. I'd have to look into further to see if there's, I don't know if Dagan, you know about that.
No, to the best of my knowledge, exposure control plans specific to a production might make them kind of make decisions based on that plan. But as far as the regulation is concerned, this wouldn't be a factor that, to my knowledge, would raise the requirements for minimum numbers of first aid attendants on a set. But again, if you know, for a production that was going through the process of using our exposure control plan template or similar to the process that Anit and Brian were describing, then those would be factors that would be weighed in tandem with other controls that they could reliably use to mitigate their risks ahead of time.
Yeah, I agree. I'll just reiterate what Dagan said. The only thing that's going to increase the numbers is distance to hospital and the amount of people that you have. So as a film and television, we've been classified as moderate activity. So you could go on to WorkSafe's website and you can really see the specific numbers you have and how many people you have, but it could be something that's built into your action plan and controls if you know that's been an issue in the past. So, I appreciate you bringing that up because if we're in that quarry during the summer or whatnot, it's definitely something we're going to look at maybe first aid.
This is an interesting question, Mona. How much of a difference does a mask really make when there are high levels?
Well, it depends if it's a fit tested mask or so actually this summer, that's what we're doing with the wildfire fighters. We're actually using 3 different masks. So we've been doing these intervention studies for a number of years now, looking at respiratory protection as well as proper personal hygiene. Because a lot of times the wildfire fighters would be exhausted after a 18-hour day. You can imagine not taking a proper shower, just sleeping in their just sleeping with their coveralls just off in the tent in camp. So we were looking at that and respiratory protection. Now it seems like respiratory protection does better to actually reduce the amount of pHs getting into the body, because we were taking urine samples as well. So we're actually looking at the real dose, not just exposure in the air. We're taking samples of the air, but we're also taking urine samples. So we're actually seeing the metabolite of benzoate pyrene, and we're able to actually see whether there's a reduction. And so we were seeing a promising reduction with respiratory protection. N95s properly fit tested though, right? So that's the thing. Now, this year we're doing 3, if you look at that CBC article, actually that's out today, it talks about 3 different types of respiratory protection that we're going to be testing this year. And we've already looked at N95s. They seem to work, but they don't want to use them because they're, every day you have to get rid of, you have to throw them out. They're disposable. They want to use some reusable ones. So we're looking at P100s, which are your regular elastomeric ones. They're going to be uncomfortable. People are not going to want to use them. Compliance is an issue, right? So, okay, then there's a mesh one and another mask from Australia. We're testing those 2 out as well and seeing if they make a difference, because we've heard good things from Australia that these are good and they're washable, they're reusable. So that's the ticket, right? Because they want to be able to reutilize them. So after this summer, we're hoping to have enough evidence to show that these masks work or don't work as well. But N95s definitely do work if you're fit tested for them and they fit properly.
Just a confirmation here. So we've mentioned employer's responsibility in measuring every hour. Is measuring every hour suggested or WorkSafe BC regulation?
Well, you're supposed to do it if you have triggered it, you're undergoing your exposure control plan. So whatever triggers it, then you're supposed to be doing it every hour.
And just to clarify, the reason why we do it every hour is because our Humidex, that way if it's over 30, then that's when we're supposed to start recording. So that's what triggers it.
Right. So to answer the question, there's a threshold for when testing every hour is taking place, and that really depends on the actual exposure control plan for that specific event, performance, or production, and where they are.
Because there's so many different ways, Catherine. You remember I told you about all the different ways that you can measure heat stress. So depending on which way you're using, there's different triggers that then you have to start doing that. And there's so many factors involved, but once you trigger it, then yes.
Fair enough. Thank you. Question. This is from Anit. Do you want to jump in with your question here?
Sure, yeah. So the IATSE app, there's a lot of talk about it. So Mona, I wanted to ask, because productions are asking how they can incorporate it into their heat stress program and whether that can sort of meet any kind of regulatory requirement, and how you plan for productions to use it. Right now, as I understand, it's a voluntary sort of as you like tool, but is there plans to make it otherwise?
You can, because it's just taking the hygrometer reading and doing those calculations for you, right? So right now, a lot of people are taking that chart, doing that, adding the values of what they're wearing, et cetera, and then they're using that as their exposure control plan. You can use this, and we actually have adopted it here at Aura. We have adopted the IATSE app to be utilized in the field, especially, we are going out to hot environments and working alongside firefighters, et cetera. So it is meeting compliance because we are doing it. We're using it as a tool. Yeah.
So productions can sort of start modifying their ECPs to include the IATSE
They
app
can,
as a
yes.
method of, recording.
Right, they can, and it's free, right? So that one thing that IATSE asked is like anyone can access it, even though it was made mainly for members, and they're only giving hygrometers to their own members, right? But anyone can utilize it. So even when I was in Phoenix, people were going, "Hey, that's a pretty neat thing." But I was like, "It's WorkSafe BC regs though, or guidelines, right?" So just so they know, but they're like, "Hey, it works," and we don't really have anything great in my jurisdiction, so they're going to use it as a screening tool too. So it's actually not a. We're just sharing, right? We were with the US, we were sharing, what's happening north of the border.
Fantastic. We've just got about 5 minutes left, and I've just got two last questions that I'd like to get through. One question was for us at ActSafe. Do we have mask fitting sessions? Please do contact us, info@actsafe.ca. We would like to assist with getting you either fit tested or provide you with someone who can do that for you. Absolutely. There's a question about, are there any limitations or control risk templates that consider both health risks, both smoke and heat? So would you recommend, Mona, always having two separate exposure control plans, or is there such a thing as one exposure control plan that covers both risks?
You can put them together, but sometimes you'll only enact one or the other, right? So we've kept them separate for our purposes. I think they just work better separate, but essentially if you put them together, they would be you'd be answering the same things, but just in one document, I guess, if that helps you to do that.
Right.
But you still need to answer all those, have all the sections and address all the things that are required in an ECP, right? So.
Right. So the limitation would be if it's smoky, but it's not hot, then
right.
Where's your trigger point and what kind of controls are you
right.
putting in for
it's
those
almost like two
different
separate
scenarios?
things you put together anyways. But if you rather see it all together, you can do that. And some of your controls are actually going to work with each other. Some of them are going to be contradictory though, right? So you might like if it's hot and smoky, sometimes you have to consider like, what are we going to do about that? We can't just close all the HVAC dampers and turn off the HVAC system because it's going to boil in there, but we're going to deal with wildfire smoke, right? Like, what are you going to do? So I think in those cases, like having those exposure control plans doesn't negate needing a specific site-specific plan for like the actual day or the activity that you're doing, right? So you have your exposure control plan that handles, all sort of live events and wildfire smoke or heat stress. But then later you have to plan for that event and say, well, okay, we're going out in this kind of environment. We know wildfire's close. How are we going to modify? What are we going to do for the event?
Right. Sorry, just an elaboration on the question. Are there additional risks to health if it is both smoky and hot? And if both cannot be accommodated at the same time, then should work not stop? And so I believe the question was if they're combined, if it is hot and smoky, not separately. I think all of the controls that are for both risks would have to be considered before any work is stopped, I think is the answer to that.
Yeah.
So here's our last question, and then we're going to have to wrap up. And it's a big one, and I don't know if we have an answer for it necessarily, but for live events and festivals, the challenge is obviously that they are outdoors. So you are not going to bring 20,000 people into a backup space, especially if you're out in the wilderness or in the regions and there's no option. The question is, are there any suggestions about what can be done to avoid having to cancel an event?
I'd be happy to hear from any of the panelists too. Well, I know it's a hard one, right? And
Yeah.
I have seen one event. No, I think that was for COVID, where they're handing out masks, right? You've seen that, right? Where they hand out.
Right.
I don't know if that's I don't know if that's a solution. But I would like to see more guidance too, and maybe that's something that we, ActSafe could take on, or something where we could provide more guidance, look at the evidence out there. What are people doing in other jurisdictions? How are they handling live events?
Right.
I think that might be a good take home question, and we can ponder it a little bit more. because I
Good
don't
point.
have the answer.
Like jurisdictions you already brought up earlier, like Australia, who's been dealing
Right.
with wildfire and smoke
Yes.
and heat for
Yes.
a lot longer than us. Okay, well, we're gonna have to wrap up for the day. We do encourage everyone, if they have follow-up questions, they can just contact us directly, info@acsafe.ca. And we will try to get to any of those questions that come in after the fact as soon as possible. If you see our email address at the bottom there, everyone knows where to find us. And if not, just look us up. I thank all of our panelists and Mona specifically for walking us through this today. Very insightful, lots of information to digest. And we'll see everyone at the next webinar.
Great.
Bye for now.
Thank you, everyone.
Thanks,
Bye.
everyone.
Have a good summer, everyone. Bye.